Think a hospital is the best place to diagnose dementia? Think again. This mistake can make things worse. Many people believe that dementia should be diagnosed in a hospital setting, but for most patients, this can lead to increased confusion, agitation, or even rapid cognitive decline. Before we dive in, I want to clarify something. This avatar was generated with AI, but the information I'm sharing comes from real experience as a specialist in psychiatry, psychotherapy, and geriatrics. It is based on established medical guidelines and years of clinical practice. I used to work in a memory clinic where I focused on dementia diagnostics and guiding families through early care planning. Now, I work exclusively with dementia patients on a closed psychiatric unit, where I see firsthand what happens when care decisions come too late. One of the biggest mistakes I see: families waiting too long before getting the right diagnosis, and sometimes choosing the wrong place for it. A hospital may seem like the safest place for a diagnosis, but for dementia patients, it can be overwhelming and harmful. Here's why. Unfamiliar environments cause distress. A hospital is loud, busy, and full of strangers. This can increase confusion and agitation. Risk of hospital delirium. Many dementia patients experience acute cognitive decline in hospitals due to stress and changes in routine. Loss of independence. Being in a hospital bed, surrounded by medical staff, can make a dementia patient feel powerless and disconnected, not a real-life setting. Doctors may misjudge symptoms because hospital behavior does not reflect daily life at home. For many patients, this means that by the time they leave the hospital, they're in worse condition than when they arrived. Of course, there are situations where inpatient diagnosis and care are required. A hospital admission may be necessary when the patient is wandering or getting lost, creating a safety risk, aggressive or violent, putting themselves or others in danger, neglecting basic needs such as refusing to eat, take medication, or accept any outpatient help, experiencing sudden and severe mental decline, which could be due to infections, strokes, or metabolic issues that need urgent treatment. Outside of these cases, hospitalization is not the best option. So what should you do instead? The best approach is to diagnose dementia in an outpatient setting. This includes memory clinics and dementia consultation hours, where specialists assess cognitive function, at-home evaluations, which provide a realistic picture of daily abilities, regular outpatient follow-ups, allowing doctors to track progression without the stress of hospitalization. A familiar environment helps reduce anxiety, provide a more accurate diagnosis, and maintain the patient's quality of life. If your loved one is showing signs of dementia, don't rush to the hospital unless absolutely necessary. Instead, seek an outpatient diagnosis in a calm and familiar setting. In the next video, I'll talk about when hospitalization truly becomes unavoidable and how to prepare for it the right way. Stay tuned.